today I'm interviewing Diana and Dr. Nick. So let's get started. The first question. The topic on the table is non-surgical treatment. What would you say is the biggest misconception among patients that enroll in the intensive program?
I might say two things. One would be the understanding that that scoliosis, that fusion surgery or surgery in general is required or needed. So that if, typically most orthopedic docs, once those curves reach around 40 degrees, then now you are a candidate for surgery. And yet the language is often used as, oh, now you're 42 degrees or whatever, now you need surgery.
Oh.
So I think a lot of families get that message from the docs that because we're over 40, we have to have surgery now. And yet realizing that according to the orthopedic research, there is no medical necessity. So the fusion process doesn't cure scoliosis, it just surgically straightens with metal rods so that aesthetically that patient's straighter. They're never going to get it to zero, but if somebody had an 80-degree curve, they'd be happy to get that to 30 or 40 degrees maybe, but then it's permanently like that forever. And so it's just the research shows that long-term those patients are going to have pain and dysfunction from that too. So the way I've often talked about it is that you're kind of trading one deformity for a different deformity. A patient has a flexible spine, but a curve when it should be straight, and they trade that for a at least straighter spine, but now permanently immobilized. So it often could just be trading one set of problems for another, but it's all under this guise of it's fixing your scoliosis or curing your scoliosis, and that's not really the case. So I think when we talk about the side effects and the cost and what it's like when somebody's fused, for most people, especially for teenagers that are fused, it's 13, 14, 15 years old, somewhere in there. The research shows, I think it's either 5 to 10 or 10 to 15 years, they typically have lots of really good pain relief if they had pain to start with. If that was sometimes a motivating factor for doing the surgery. And so, but after that, that's when often a lot of the chronic long-term pain starts, right? Well, that's like most people anyways. When you get to your 30s, you don't know anything about that yet. But once you get older, you start hurting and we feel a little bit different.
Yeah.
So the idea is that, 1-2 years after surgery, it's amazing. They're straighter, they're taller, and there's a lot of perceived benefit. But it's still because they're teenagers and, young teenagers or 20-year-olds, and they feel great anyways because you're going to feel great at those ages anyways. But that's kind of a short-term benefit, and many patients, once they get a little bit older after the fusion, that's when they start getting into chronic degenerative conditions of the spine, because that's what happens with fusion. All the other joints are going to start degenerating and have problems. So it's kind of that issue of necessity. It's more of an aesthetic treatment that will make you taller, make you straighter, but it's not necessarily making your life better or fixing anything. I feel like that's maybe a big misconception about, and maybe that's not even answer your question, about scoliosis diagnosis in general. I think though with treatment, maybe, I don't know if I'd say the misconception, but the difficulty of a non-surgical approach like what we do is that it's not one time and you're done.
Yeah.
As you know all well. Yeah. And so I wish there was something we can do that was just you're done and you're it, but it's more holistic, and I just think it reflects reality more. Is that your body's changing all throughout your adolescence, and then once you're into your 20s, things will be different and it won't be the same, but it's a decent amount of time that you're kind of fighting against that growth that you're dealing with.
Okay.
That kind of answer your question?
Yes, it does. Thank you. All right, second question. Are there any curve and age restrictions for the intensive program?
No, I really don't think it really would come down to each individual patient. When I thought about this earlier, I was thinking more of larger curves or bigger like that, because I think the largest curve that I've actually kind of worked with was a patient that had 105 degree scoliosis, and she was an older woman in her 50s. I'm not older woman, but she was in her late 50s. And yet she was wonderful. She's like, I get some back pain when I garden.
Wow.
And I was like, I get back pain when I garden. So she did great. But a lot of the treatment we did, she just couldn't tolerate it. It was too much. But she ended up getting the scoliosis traction chair, and it did wonders for her. So I think really limitations come down to just what kind of each individual patient can do. Thinking about that more, what I was realizing was the younger kids. I think maybe the youngest patient that I have seen do the entirety of the full clear program, what we do here, is probably in that like maybe 6 to 7 or 8 year old range.
Wow.
Because again, getting a younger child like that to exercise or do these specific things, that can be kind of tough.
Yeah.
Now, I think the youngest girl I've seen do it well, not one of my patients, but out of another clinic, she put on this big cantilever and could stand up and balance really easily. The youngest we've had here was a boy, I want to say maybe he started at 6.
Oh, wow.
But he can't do anything himself. So his mom has to do put it on and all that. But he's had a severe progressive case, an infantile case. So he's had it since he was little. So it's like he's been dealing with this for a long time.
Yeah.
So not in terms of curve size. I mean, even, a 40-degree curve in a 13 or 14-year-old versus a 70-degree curve in 13, 14-year-old, there's not that dramatic differences in them being able to do the care. It's more of just recognizing what's the expectations. Because I've seen some patients that were going to be surgical candidates no matter what. They were going to have fusion. And one patient actually ended up doing VBT, vertebral body tethering, and they weren't a candidate because they didn't have enough flexibility.
Oh, wow.
So they did an active rehab program, like clear, and what she got was a little bit of reduction in her curve, but what she gained was a ton of flexibility.
Wow.
So because of the active rehab program, she now is a candidate for doing the VBT, which she wasn't. So there's different aspects of what's the goal of our treatment, and that might be different for different patients.
Yeah.
So I think that's maybe the best way of saying that. There's not as many limitations, because some patients it might just be flexibility that is our goal. Another patient, actual reduction and stabilization of the curve, which is harder. Those are just different goals.
Yeah.
So those can be different in how you're reaching those.
All right, thank you. All right, last question. In what ways do you keep patients uplifted when they don't achieve the results they anticipated?
It's hard. That's a hard one. I think that I'm always trying to talk about, and maybe just like managing expectations, right? Lots of patients just want to see a 50-degree curve go down to 30 degrees or something like that. And that's sometimes just not reality. And so I think I try to just be honest with them, but that it's not always just about, say, a curve size. I've had a number of adult patients that even getting just a little bit of reduction in the curve, that's great and all, but what they get is how they feel. It's so much different that way. So it's not always just about one factor like the curve size or that. But so I feel like how we talk about these things on the front end helps the patient get good expectations or good accurate of what we should be expecting, or even just what matters. Because again, sometimes curve size doesn't matter. Like teenagers, it's a little bit different. I feel like we're focusing on that a lot more. With adults, most adults don't care. They just want to feel good. They just want to be able to play with their kids or grandkids or garden or whatever. So I think how we talk about the expectations about what is important, it's often way more than just that cob angle. And yet, in most of the medical management and other chiropractic management, that's the only measurement. It's just that curve size. And you, or a patient with scoliosis, is way more than just that curve size. So flexibility is a big deal. Patient who doesn't have enough flexibility, two patients could have the same size curve and almost look identical, but the one with more flexibility probably is going to do quite a bit better in everything: pain, stiffness, mobility, flexibility. So I don't know. So I think I try to at least frame things and we talk about it so that whether I'm talking with a 12-year-old or a 17-year-old, talking away it in a way they can understand it and feel comfortable with it. But that's a big question, because I've never been in your shoes. I don't know what it's like. I know a number of people around me that have scoliosis, so I know real kind of intimately what that's like, having it, living with it. I don't know. And I think at least me, I find myself in general, I'm very much an optimist and idealist. I don't know. I want to be joyful, and I think sometimes that's just that'll rub off on me. So hopefully with my patients, that's what I'm. Hopefully that I carry with them a little bit.
No, yes. Well, you definitely been uplifting to me, and thank you so much for joining. And I cannot wait to work with you.
Yeah.
All right. Bye.
somebody